A sprained ankle is one of the most common orthopedic injuries. Every day, about 25,000 people in the U.S. suffer an ankle sprain. Ankle sprains can happen during sports, especially when a player lands awkwardly from a jump, or when the ground is uneven. There are three types of ankle sprains. The most common type of ankle sprain is the inversion sprain. This type of sprain occurs when the lateral ligaments are injured from an outward twisting motion of the foot. A much less common type of ankle sprain is the eversion sprain. This happens when the foot is twisted inward and the medial ligaments are injured. A high ankle sprain is when the interosseous ligaments between the tibia and the fibula are injured. This type of injury is also less common than an inversion sprain, but it can be more serious and take longer to heal. The body's natural response to an ankle sprain is vasodilation of the ankle tissues. This causes inflammation, which is the first step to the healing process. Unfortunately, inflammation can also cause pain and other adverse effects, so the goal of the treatment is to reduce inflammation. This can be done by applying the Rice method. Rest, ice, compression, and elevation. Resting the ankle prevents further injury and avoids stress on already inflamed tissue. Put the ankle joint at rest by wearing a brace or splint. More severe sprains may be treated with the use of crutches. Ice is the best treatment. Applying ice to the injury will help decrease pain. Ice counteracts the increased blood flow to the injured area. It reduces swelling, redness, and warmth. Applied soon after the injury, ice prevents much of the inflammation from developing. Do not apply ice directly to the skin. Instead, put a towel or cloth under the ice. Also, apply ice to the injured ankle for 20 minutes at a time with at least an hour between icing sessions. These precautions help prevent frostbite. Compression provides support and helps prevent inflammation. Elastic wraps such as ACE bandages immobilize the ankle, but be careful not to apply wraps too tightly. Elevation will help the body absorb fluid that has leaked into the tissue. Ideally, prop the ankle up so that it is above the level of the heart. Sit in a reclining chair or prop your legs up with pillows. Another thing you can do is put books under your mattress by your feet. This will elevate your ankles as you sleep. Anti-inflammatory pain medications such as ibuprofen and naxoprene will reduce the pain and combat swelling. When the pain subsides and function is fully restored to the ankle, your ankle is healed and you can return to activity.